Welcome again. It's your medic, the D.O.N Health Hub, and today we are here to talk about a certain condition which is very common amongst ourselves in the community, and so many people have requested that we do a review of the condition so that they can familiarize with the management, symptoms, the definition, how it presents, all those stuff. Now, that one quickly takes us to the definition of the condition, which is meningitis. So today we are here to talk about a condition called meningitis. It's a condition that's very common in our hospital setup. So let's do a quick review about the condition. So quickly, what is meningitis? Meningitis is simply the inflammation of the meninges. Now, what are meninges? Meninges are the coverings of the brain and the spinal cord. Full stop. So for educational purposes, references of all those stuff, you can use the simple definition that I've just given. It's very helpful and straight to the point. Now, that one quickly takes us to the types of meningitis. We have bacterial meningitis. From the name bacterial, it is the one that is being caused by the bacteria. We have fungal meningitis caused by the fungus. We have the viral meningitis, parasitic or amoebic meningitis, and also the non-infectious meningitis caused by the medications, cancer, and autoimmune diseases or head injury. Now, what are the symptoms of meningitis? So, symptoms here are grouped into two classes. First, we have the cardinal symptoms and other symptoms. Now, the cardinal symptoms are like, in other terms, these are the main symptoms of meningitis, which if a patient presents with those symptoms, you will just know automatically that this patient might be suffering from meningitis. So, on the cardinal symptoms of meningitis, we have the neck. People, let's continue with the symptoms. So, on the cardinal symptoms, we have things like neck stiffness, we have headaches, and fever. So, those are the cardinal symptoms of meningitis. If a patient presents with those, you will automatically know that this patient might be suffering from this condition. Now, on the other symptoms, we have things like nausea, vomiting, we have sensitivity to light, or rather, you can call it photophobia. We have seizures, we have skin rash. Yeah, and those are the other symptoms of meningitis. So we have the diagnostic test of the meningitis. And on the diagnosis part of it, it's also divided. We can do the physical exam, we can have the laboratory tests, we can do the lumbar puncture, blood cultures, and imaging. That is includes CT scan and MRI in certain cases only. So on the physical exam, we look for the neck stiffness, where it's also divided. There's something called the Canning sign and the Brudzinski sign. So on the Canning sign, you find that this is where let me do not a demonstration, but how it's being done. We'll do the demonstration on the next video. So Canning sign, a patient lies on the back, that is supine position. Then hips and knees are flexed to a 90-degree angle. The knees are then extended while keeping the hip flexed. So through that one, the patient will feel pain because the movement stretches the inflamed meninges and the spinal nerves, causing discomfort. So it's very simple. Patient is instructed to lie at the back, or rather the supine position. Then the hip and the knees are flexed at an angle of 90 degrees. Then, while keeping the hip flexed, the patient will feel pain because the movement stretches the inflamed meninges now in the coverings on the brain and the spinal cord, causing discomfort. So through that one, the patient will feel pain, and you'll automatically know that this one is suffering from meningitis. Another sign is called Brudzinski's sign. On this one also, again, the patient lies on supine position, or rather at the back. Then there's flexion of the neck, which will cause involuntary flexion of the hips and the knees in a supine position. So This one I can do a quick demonstration. If a patient lying at the back, if you flex the head like this, the hip and the knees will tend to rise up, and the pain will be felt at the hamstring area. So that one is a Brudzinski's sign. So those are two major signs that are used on the physical sign part to demonstrate whether the patient has meningitis or not. So we also can do the laboratory test and also the lumbar puncture, or rather it's also called the spinal tap. So through this one, the cerebrospinal fluid is extracted from the patient and taken to the lab, so that the culture and any other stuff can be done to determine whether the patient has meningitis. Then we can do the blood cultures to look for maybe the bacterial one on the blood for infection. We can also do imaging, the CT scan and MRI. So these ones will help us to know the extent at which the meninges has inflamed, or again it will show the inflammation of the meninges of the brain and the spinal cord. So this one will also show us that the patient is suffering from meningitis. Now on the prevention, we have vaccination. Yeah, you can do vaccination. That one is to prevent the meningitis from taking place. So we have the meningococcal vaccines, the pneumococcal vaccines, and yeah, also we can do hygiene, washing our hands, sharing drinks and utensils outbreaks. So you can do the washing, and prophylactic antibiotics can be given to prevent the meningitis from occurring. Yeah, so thank you very much, and that one was just a quick review of the condition that is called meningitis. We'll do all the demonstrations and all those stuff in our next video. Thank you very much. Goodbye.